Everyone, welcome to our third of four survivorship wellness series. This one being called Managing Cancer-Related Fatigue. Next, meet the survivorship team. So these are our lovely faces. Alondra's in the top left and at the bottom of your screen. So she's a nurse practitioner with me. I'm in the middle, and Hannah is also our third nurse practitioner. So the three of us see patients post-treatment with our survivorship visits. Hannah specifically does gynecologic oncology, and then Alondra and I kind of do all the above. And then Aaron in the middle, he's our survivorship nurse navigator. So he is kind of just that integral part, pulling us all together, helping with these wellness series, calling patients, support, coordinating, scheduling, all the above. So that's Erin. And then Misty, she's on the line as well. She's one of our social work supervisors here in the Cancer Center, helping all oncology patients. We would be lost without her, pretty much. And she actually originally did the survivorship wellness programs before we had this team. So we're very lucky to have Misty. And then just a quick blur, like a second about our survivorship program in general. So as I said, we do have survivorship visits with the nurse practitioners, or Erin can help coordinate in any way when you're post-treatment. And not only do we have the appointments, but we do these wellness series and try to get out in the community and help with coordination and stuff like that. So our survivorship program has grown a lot throughout the last couple of years and included a lot of different things. So we're just really proud of it. And I know Alondra agrees, we just love what we do. So that is that. And then next, I want to introduce Liz Rice. So she is our guest speaker tonight. She is a doctor of physical therapy with years of experience working with high performance athletes and orthopedic patients in the outpatient setting, as well as treating many different patients in the hospital, such as orthopedic, nephrology, general surgery, oncology, hematology, cardiac, and those in intensive care units. She has obtained her lymphedema certification, and most importantly, she focuses on cancer-related rehab for our oncology patients. For almost 3 years, she's worked as a site clinical coordinator and educator, establishing clinical relationships with lots of different universities and supervising and assisting students and clinical instructors. So we're really excited to have her talk to us tonight about cancer-related fatigue and kind of how to manage through it, and kind of tips and tricks of what to do. So before I pass it on, I'm going to not forget this time and take my video off so you don't see my lovely face throughout all of the presentation. You too, Alondra.
Awesome. Well, thank you, Allison, for introducing me. And so we'll go through, like they said, we'll have you guys put the questions at the end, and they're also going to try to flag me if there's questions as we go along, but I'll try to give you guys some good information tonight. As she said, the title is Managing Cancer-Related Fatigue. And so I put the little minion in there. I thought it was kind of appropriate for our topic tonight, because I hope some of you are here because you're experiencing this, and I really hope we can give you some tips and tricks and tools to help out with that. So a little bit more about myself and the objectives. So for the objectives, we're going to talk about what is really survivorship, the top side effects of cancer, what really is cancer-related fatigue, and then what are the treatment options, what are your roles if you attend physical therapy, and how can we combat cancer-related fatigue, and there's just other various resources and tips on how you can also combat cancer-related fatigue. So I just put this in because this is really why we're here tonight. So this is the Christ Hospital mission. So they actually changed this over the past year. So our new mission is to, we anticipate, we are, we build, and we act. And I wanted to put that in because this survivorship program is really awesome. And like I said, this is really why we're here tonight. So with that being said, we're trying to be forward thinking. We're trying to help people before really they have to come and they're so far down the road. So we have a shared determination. We're trying to be forward thinking. We're trying to be inclusive, and we're trying to serve the needs of those who we serve, so our patients. So I just thought it was very appropriate to include in here. So this is why we are here. And this is who I am. So I put in the shameless plug with my kids. I feel like everybody who presents always does this. So like Allison said, I've kind of worn a lot of different hats with what I've been doing. I've worked in the Yankees training facility. I've worked with numerous cancer patients. I've worked in the hospital setting. I've been our site coordinator for education. So I've done a lot of different things. And I think I've been able to take a little bit from each experience that I've had. Before I actually transitioned to Christ Hospital, my focus for a year and a half was actually creating a cancer treatment program at another clinic, which is when I got my certification as a lymphedema therapist. And I really loved what I was doing. I just had a great opportunity to join Christ. So I'm really excited to be able to do that now at Christ Hospital. And then just a little bit else, I'm also a strengthening and conditioning specialist. So it helps when you're trying to help people get better as well. So survivorship. So most of the people who are here tonight are probably fall in the category of survivorship or know someone who is, or both. So I figured we should start by defining that. So a cancer survivor really refers to anyone who's had any history of cancer. And it really refers to anyone from their time of diagnosis and through the remainder of their life. These numbers are increasing dramatically as the years go on. I did a presentation a couple years ago, and we're actually up about 3 million from when I did my last presentation that was a related topic. So right now we really have about 16.9 million survivors, and it's estimated to increase to about 22.1 by 2030. So this is a huge population that we're looking to try to help. And, in terms of males, the most common cancer that we see in terms of survivors would be prostate, colon, and rectum, and melanoma of the skin. For women, it's breast, uterine, and colorectal. So kind of a big variety out there. Most of our survivors, about 67%, were diagnosed 5 or more years ago, and about 2/3 of them are over 65. So these numbers, like I said, are going to keep increasing. And the awesome thing is we're getting better and better at our treatment. So there's going to be more and more survivors who we can hopefully be helping. I put in a couple of quotes I just felt were kind of practical or this kind of went along with our topic tonight. So the first thing was at least 20 studies of people with breast, colorectal, prostate, and ovarian cancer have suggested that physically active cancer survivors have a lower risk of cancer reoccurrence and improved survival compared with those who are inactive. As we go along tonight, you'll see a lot of our discussion will be how to be active and how that can help with fighting the fatigue. And so I thought these were going to be a good way to tie together what is survivorship and also why is this topic important to all of our survivors out there. The other quote I included was, exercise can reduce the risk of developing colon cancer by 30 to 40% relative to those who are sedentary, regardless of their BMI, with the greatest risk reduction seen among those who are the most active. There's been a range of studies that have shown the positive trend between exercise and breast cancer reoccurrence. It's kind of a big range, but they said it can actually reduce it anywhere from 20 to 80%. And then for lung cancer specifically, a 20% reduction. So these are really some positive numbers that there's something that we can control that really could help our survivors out there. So side effects. So side effects of cancer. And so what our survivors out there are experiencing would be common side effects such as depression, pain, fatigue, and lymphedema. Those are the most commonly reported. So fatigue is a big topic, which again, that's why we're here tonight. So fatigue is described as distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer and cancer treatment that is not proportional to the recent activity and interferes with the usual functioning. There's actually been a lot of studies on the numbers of people who will experience cancer-related fatigue, And the numbers are pretty alarming in the sense that they are essentially estimating that 80 to 100% of our survivors will experience this at some point. So weakness and fatigue are often used synonymously, but they're really different things. So I thought one thing that would be appropriate would be to essentially describe what the differences are. So weakness is actually loss of your strength, or your actual body requires the effort to move. So if you lose your strength and you become weak, it can feed into fatigue. Fatigue is the actual feeling of the lack of energy or the tiredness. And there's lots of factors that can play into why someone feels fatigued. So it could be overworking, poor sleep, stress, suboptimal physical activity, illness, or treatment related. Cancer-related fatigue itself is described that it just feels different. It's different from your normal fatigue, and people describe it as feeling very weak, they're listless, they're drained, or washed out. So extreme cancer-related fatigue can cause a person to be so tired that they can't even do things. So walking to the bathroom, using a remote, thinking, some of your basic activities just to survive every day. Your rest provides temporary relief from your cancer-related fatigue. And cancer-related fatigue can also be associated with pain, nausea, vomiting, depression. And there's a huge range with this. People have reported it can last for weeks, months, or years, even after your treatments end. So what is actually the cause of cancer-related fatigue? We care what's causing it because we need to figure out how we're going to make it better. So cancer and treatment itself can cause cancer-related fatigue. This science in terms of some of these medical processes are not entirely my forte, but so I can't speak to what proteins and hormones, but they're noted to affect protein and hormone levels that are linked to your inflammatory processes. And then when you have an actual cancer treatment, it can kill both your normal cells, so your healthy cells, and also the cancer cells. So your body then has to use extra energy to essentially clean up or repair the damaged tissue. And so your body is essentially using up your energy for something else. And then your cancer itself can cause an accumulation of toxic substances in your body. And your body's now working in overdrive to try to flush these substances. And so with that being said, it can affect how your cells work, again, using up your energy. So how do we treat cancer-related fatigue? So I think the biggest issue with cancer-related fatigue is trying to figure out, well, what is actually causing it? Like I said before, on one of the previous slides, there's a lot of different factors that can play into why someone has cancer-related fatigue. So the first thing we try to do is see if there's an identifiable cause. So does the person have an infection? Is there a fluid imbalance, electrolyte imbalance, cardiac dysfunction? And normally that would be the doctor determining those things. And then we can look at those ways that we can do non-pharmacological interventions. So if it's not something where we have to treat one of those issues, then we can start looking at moderate exercise program. Maybe it's stress management. Do we need to address nutrition? Do we need to look at sleep interventions? And these interventions luckily have been shown to be favorable. So most of your physical therapists you'll find are pretty conservative in regards to what kind of treatments we like to offer. So it's always beneficial to us when there's something that's somewhat conservative that we can do to help our patients. I also wanted to mention at this point, I put in the link for the survivorship website. There's a lot of different talks on there for the non-pharmacological interventions that I mentioned. So that's something to just kind of follow up and look if you haven't seen any of these other programs. So how to begin? So if you think you have cancer-related fatigue, where do you start? So the first thing would be to discuss it with your medical team. So that might be your oncologist, it may be your surgeon, it could be your primary doctor, it could be all the above. And then there are tools out there that are for measuring essentially cancer-related fatigue. I'm going to describe some of those tools. So that may be something to consider. You can start to look at these tools and determine, do I have cancer-related fatigue? How severe is it? Is it time to do something about it? And then going along with that, is it also time to consider meeting a physical therapist for an evaluation or not? So how to measure cancer-related fatigue? There's different ways you can go about this. The simplest way is essentially just a simple scale. So a verbal rating. So someone may say on a 0 to 10 scale, how fatigued are you on average during your day? So 0 would be you're not fatigued at all. You can do all the activities you want. And then 10 would be the worst fatigue imaginable. So I described essentially that fatigue of not being able to think clearly, no interest in TV, maybe you can't even use the remote. You just don't have the energy really to do much of anything. So that would be our 10. And then how is the fatigue interfering with your ability to function? There's some scales, and I'm happy to send these to anybody who would like copies of them, whether it's digital or if you'd like them through snail mail. I'm happy to share these with you. But essentially there's a functional assessment of chronic illness therapy. And so it's a 13-item scale that we can have patients fill out that really measures a level of fatigue with daily activities. So how tired are you getting when you're doing your stairs, when you're getting dressed, when you're bathing, and things like that. And that will actually quantify or give us a number of severity of your cancer-related fatigue. And then sometimes it'll help us determine what is the best route for going to address the fatigue itself. So one option for measuring cancer-related fatigue would be to undergo a physical therapy evaluation. So with that being said, at a physical therapy evaluation, you're going to have a PT who's going to take your history. They're going to take your medical history as well as a history on how you do normal things. So we want to know, how do you normally get around? How do you normally get dressed? Do you use equipment? And then we'll also want to know about the onset of the fatigue. What is its pattern like, the duration? And then are there any associated factors that trigger it, or are there relieving factors? This will give us some ideas of how we should start moving forward. Most likely you'd be asked to complete a scale, kind of like the scale I mentioned before. And that'll also give us an idea of really what activities you like to participate in and what are being affected. And then we typically assess the overall strength and motion. So they might look at your posture, they might look at your body mechanics, your walking mechanics, your balance, how you look doing functional activities like standing up from a chair, lifting and bending. A lot of times if you're doing these activities and you're doing them in an inefficient manner, you're just wasting energy. So we are essentially the movement experts. So our evaluation is essentially to look at everything you're doing and try to see how we can make things easier. We might also use some special tests to essentially quantify or identify the level of impairment. So like I said before, there's the subjective ones where we kind of have you fill out a questionnaire and you give us information about what's going on. And then therapists like to measure things. If you've ever been to a physical therapist, you probably have experienced that. So with that being said, there's a number of tests that we could consider running. And the other benefit is when we run these tests, it gives us essentially a starting point. So we can see essentially where you're starting, where the deficits are, and then over time, hopefully show the improvement, which is always a rewarding thing. So I'm just going to go over a couple of those because these are things that we do pretty often. Unfortunately, since we're not in person, we won't be demonstrating these. I saw a previous recording and they actually were able to get participants from the audience. So I would be surprised some of you at home are testing some of this, whether now or later. But a 2-minute step test is essentially you're lifting your height, your leg up to a height of tape, and it's about the height a little bit below your pelvis. And essentially from there, they're counting how many times you raise your leg over 2 minutes. And so each leg raise on one on each side counts as 1. And then there's some data that essentially tells us what the normative value is. So what would a normal, healthy, unimpaired individual, what would be their number of lifts that they could do over 2 minutes? It's a pretty difficult test, actually, measuring endurance. A 6-minute walk test is essentially measuring a distance walked over 6 minutes. And so again, this is looking at endurance. And you can use an assistive device, so a walker, a cane. But again, looking at how much you can do over a 6-minute span. There's functional aspects of this in regards to maybe being able to cross the street, getting to Kroger, getting around Kroger, different applications that would apply to. There's what we call Berg balance assessment. So that is 14 different tests of balance. So then we can look to see if there's any balance deficits. There's also the 30-second chair to stand test. So with this, we calculate how many times the person can do a sit to stand from a normal height chair, but without using their arms, and doing that over 30 seconds. So again, these are ways that we can determine if there's a fatigue issue And we also know what the values are that we would like to work towards. While this is going on, you should have your cardiorespiratory response monitored. So we're looking at how your heart's doing, how your breathing's doing, and how you're feeling while you're doing these activities. Then we're going to take all this information, especially determine goals. So what does the patient want to be able to do? How can we help you? And then what is the plan? So what are we going to do from here? So with this, there's other ways outside of that PT can help you. So anytime you're getting activity or you're addressing some of those issues that I mentioned, you can increase or improve a bunch of different things. So one would be cardiovascular function, quality of life. So being able to do more would hopefully help with your mentation and your overall satisfaction. Body composition and weight, balance, strength, and flexibility, bone regrowth. I mentioned mentality, lymphatic flow. So one of the best things you can do for lymphatic flow is movement, pain, scar tissue. We'll address any scar restrictions, things like that. That could be a factor into why someone is having this fatigue if they're unable to move normally because of the scar tissue they developed. Nausea. Also just education. We can help our patients. We spend a lot of time with our patients, and I think we develop really good relationships and really get to know them well. So I found that our patients really feel comfortable coming to us with questions, and we have the time to answer them. So a lot of times just giving education of various topics, as well as referrals, and I have another slide where I'll talk about that a little bit more. So in terms of the referrals, there's a variety of healthcare professionals and services that could be beneficial to you. So that's something that we are happy to help with if needed. So occupational therapy, speech therapy, maybe a dietitian, psychological support, palliative care for pain-related issues, support groups, and community exercises programs. So we started off on this because the question was, well, how do I get started? So one thing also would be questions that consider asking your PT or your medical team as you're starting to get started with combating your cancer-related fatigue. So one would be, what types of activities or levels of activities are safe for me to do if I'm undergoing treatment? How do I practice energy conservation to be able to do the things that I need to do? And I'm going to put some tips in later where we'll discuss this. How do I monitor my fatigue? What type of resistance and aerobic training programs can I include in my daily fatigue to help manage my fatigue, or routine to help manage my fatigue? When can I start exercising? And what other services would I benefit from? So there's some precautions that I would suggest before you start any kind of exercise. So one would be, things to note would be certain drugs and treatments that a cancer survivor may be taking or undergoing can affect your heart rate or lungs. And so that's why one of the first things that I mentioned was getting cleared by your doctor for exercise or activity. If you come for a physical therapy evaluation, typically we're in contact with the doctor, and so we would get these parameters before. But let's say you're starting this on your own, it would be good to be talking to your doctor beforehand. You also might want to check with your doctor if you've been having any issues with your red cell counts. That can also affect fatigue and exercise. It can affect your breathing as you're doing activities. So that's always good to make sure that you're stable in that sense before. And then also something to consider is you might just want to avoid public areas. So gyms. Unfortunately, that's why we're here remotely between COVID. And then specifically if you're someone who has a low white blood count, they may not want you in public areas. So those are things to maybe be discussing with your physician. And another thing just kind of generally would be sure to hydrate. So if you're going to start increasing your activity, if you're going to be sweating, you're going to want to talk to your doctor about what's the appropriate amount for you. Other precautions before you start exercising would be you do not want to start exercising if you're having abnormal symptoms or symptoms which you have not discussed with your doctor. So example, if you've started some new nausea, pain, vomiting, you would want to follow up with your doctor before you're starting any new activities. Maybe talk to your doctor about any restrictions. So maybe they want you to avoid swimming because of an incision that you have. maybe you have lifting restrictions. From working with some of my doctors, some of them prefer that patients have a lymphedema garment on when they're exercising, some do not. So each doctor has their own ideas, and hopefully, since they know you well, they should be the ones that give you a little bit of guidance. And then also, when you do start working out or doing any kind of new activities, you want to ease into it. So start with low numbers, do light, and you want to kind of go into it easily, and I'll talk about that a little bit more in another slide. So exercise and cancer-related fatigue. So really the biggest thing is be prepared to adapt. So it sometimes seems counterintuitive to be thinking, okay, I'm going to exercise when I'm tired. So one thing to keep in mind as you start new activity would be what may be a lower moderate intensity activity for a healthy person might seem like a high intensity activity for some cancer survivors. So that's something to keep in mind. I have another quote that discusses it a little bit. Sometimes we can be our own toughest critic. So I also have some suggestions in regards to that, but the point is just be ready to be adapt. And well, like I talked about before, you might need to start easy and work up. It might be less than what you were doing before you had any cancer treatment or diagnosis. So in terms of the best type of exercise to specifically address cancer-related fatigue, the research has really showed that rhythmic and repetitive movements of our large muscle groups are best. So when we think of big muscle groups and rhythmic repetitions, we would think of walking, cycling, and swimming. Walking is great because it's low impact, but you still are getting some form of impact, which is good for bone regrowth. Cycling is good because it's a non-weight bearing exercise, so you're not pounding on your joints a lot. And then you can adjust resistance. And then swimming. With swimming, it's really good to be, again, similar to cycling, offloading your joints. And it's also really good for working on your breathing. So those are some of those exercises that really they've shown are some of the most beneficial for combating fatigue. And then some may have to work up their strength and flexibility or change their moving patterns before doing some of these activities. So what I mean by that is if your hamstrings are too tight and you're trying to lift weights, but you're having to compensate by bending from your back too much, you're more at risk of hurting yourself. So sometimes, especially if you see the PT, they're going to look at how you're moving and address any issues before they start working up to some of these, what I would consider a higher level activity. And then the activity, like I said, should be initiated gradually. So with a gradual progression, and the goal would be to have what we consider a moderate level activity. And I'm going to really describe in one of these other slides coming up what moderate means. So these are some general exercise guidelines. So the Academy of Sports Medicine, as I just said, all patients should be encouraged to be physically active, which is our theme. That an individualized program should be established based on the person's abilities and also some of the things I talked about before. So, not every person should be doing the same exercise for the same amount of time. A general guideline would be to work over to a weekly volume of 150 minutes of moderate activity. It talks about vigorous activity, but really for cancer-related fatigue, and also just a lot of research across the board, really the most beneficial data has shown to be for moderate activity. The other thing too is when you're working on this, you have to keep in mind, this might be a long-term goal. We do not expect someone to go out there and be doing 150 minutes of moderate activity. So this is something where you eventually work up to if possible. And so with that, they also recommend 2 to 3 sessions a week of strength training. And strength training could be as simple as doing some of those sit to stands I was talking about, some of those marching, different things. It doesn't necessarily mean weightlifting. They also recommend that stretching should be done regularly. So when we're exercising, we're using our muscles, we're tightening our muscles over and over. So gentle stretching is also good for prevention of any injuries. And so again, these are just general guidelines and recommendations. A physical therapist could help you with specific to you, but those are just some kind of general idea of what to expect. So with a warm up, so let's say you now have decided I have fatigue, I'm going to try to address it myself. So if you're going to ease into activities, you should do so by warming up. So about 5-10 minutes. A warm up would include something like maybe just walking, intervals of walking. So you do some walking, you stop, start, stop, some light jogging intervals. So again, just short spurts of light jogging. It could be dynamic stretching. So just stretching with some gentle movements. The benefit of warming up is you're going to decrease your stiffness before you start doing the activity, which helps prevent injury. And it also gradually increases your blood flow and loosens up your muscles. It never feels good to just go and start doing 100% and not be warmed up. So warming up is really going to help with that. And then if you were monitoring your heart rate, which we'll talk a little bit about what a max heart rate should be for someone, but a warm up should be about a 50 or 60% heart rate. So really your heart shouldn't be pumping very high when you're doing this. It should be pretty low. So I put this in to give you essentially an idea of what the expectations should be for when you're exercising. So our goal is to work up to this moderate activity. So moderate activity is essentially, if we're on this like 1 to 10 scale, it's a 4 to a 6. And the most important thing is you can still carry on a conversation. So, you know, you're working and you might be breathing hard, but you can still have a conversation as you're doing it. And so this is a very subjective scale, but this is also something that we use when we're talking to someone who has cancer-related fatigue, and we're asking them, what would you rate the you know, how strenuous was the activity you were doing? How would you rate it? So at the beginning, someone may come in and say, sitting on the bike for 10 minutes, they would rate as a 9. And so the goal is with the activity increase to essentially be able to do the moderate activity and be able to carry on the conversation. And so you may have to adjust again, like I was saying, with what you're starting, because we want it to be a moderate activity, and that might look different from the beginning to the end of when you start your activity. So I thought I should put in some examples of what like a light and moderate exercise should look like. Because if someone's thinking, okay, I know I have the fatigue, I would like to start working up. So what is generally considered light exercise would be a leisurely biking at like 5 miles per hour or less, light housework, bowling, playing catch, slow walking, garage work, childcare. So light exercise on that RPE scale essentially was described as no noticeable change in breathing pattern. So again, for some of you out there doing some of these activities, they may be higher. It may be harder for you to do these things. So even though that's considered a light exercise, it may be harder initially. So the goal would be to essentially increase your overall ability. So this is what you would then consider a light exercise. Moderate exercise. So like I kind of said before, you should be able to carry on a conversation. Another way to describe it is you can talk, but you can't really sing during the activity. So examples of that would be ballroom or line dancing, which I somewhat disagree with. I think ballroom dancing and line dancing, I get out of breath myself. But anyways, they say that's one of the examples. Biking on a level ground with very few hills, general gardening, baseball, softball, volleyball, doubles tennis, using a manual wheelchair, using a hand cycler, also called an ergometer, brisk walking, and water aerobics. So those are some examples of what we would consider moderate exercise, which is really our target of where we would like to get our patients and survivors and everyone to. And then vigorous exercises. So this is essentially what you can do, but this is really not what we're reaching for unless that is the patient's goal. So like I said, the literature really shows 150 minutes of moderate exercise is the goal, specifically related to cancer fatigue. However, you know, people may progress that they want to incorporate vigorous exercise as well, and that can be appropriate. So with that being said, vigorous exercise is described as being able to say a few words, but you can't really without stopping to catch your breath. And so examples of this would be aerobics or fast dancing, heavy gardening, hiking uphill, jumping rope, race walking, jogging, running, sports such as basketball, soccer, swimming laps, singles tennis, and stair climbing. So other exercises, so other things just to throw out there would be walking. So indoors, outdoors, treadmill, track, a bike, whether stationary on the road, elliptical. We talked about the arm bike, a stair stepper, group classes, so yoga, Pilates, Zumba, and then the rowing machine. So the nice thing about a lot of these is you can adjust how difficult the activity is. So based off hills, resistance, and different things like that. So those are just some other exercise options out there for people. So once you get started, these are just some tips for progression. So the goal is to progress appropriately, so you don't go to the gym on day one and then maybe you want to go the next day or even 2 or 3 days later, but you're too worn out from going the first day and now everything's kind of go to the wayside because you overdid the first day. So my suggestion to patients has always been, when you're doing any kind of exercise, only progress one factor at a time. So increase your number of repetitions or the resistance. So maybe if you did 10 laps in the pool of water walking, instead of the next day doing 15 laps and holding on to a kickboard and using it for resistance, you do one or the other. Same thing, maybe you're doing something simple like a bicep curl. So you're doing a 5-pound weight and you did 10 of those the first day. What I would suggest is not then going to 10 pounds and doing 20. So that's one of the nice things, is if you essentially just change one factor, you can make it more difficult, one or the other. There's different ways you can finagle it. And then a rule of thumb that I had adapted for my patients was you should do this exercise 2 times and have it be essentially easy for you. And then it would be time to increase the reps or resistance. So the reason I suggest that people do the exercise or activity at least 2 times in the same manner before you start adjusting it is maybe on Monday, you slept really well overnight. So you went to the gym or you went to the pool or at home, you did your exercise and you felt really good. So then Tuesday or Wednesday, you come back and you think, well, you know, I felt really good on Monday, so I'm going to do more today. You might have felt better on Monday because of certain factors that were in play. Like I mentioned, the sleep. So instead of going ahead and increasing, what I would do is do the activity at least 2 or 3 times. And if it's been pretty easy 2 or 3 times in a row, then it's time to go ahead and start making it a little bit harder. Another thing to consider would be maybe just alternate days. So this can help with not fatiguing a certain part of your body. So maybe day 1, you swim, maybe day 2, you work on your legs, maybe day 3 you rest, and day 4 you do arms or things like that. So if you find that a certain part of your body is too fatigued and you're trying to do a little bit each day, maybe you rotate what area of the body you're focusing on. So just other random tips for success. So when you make a plan, you go ahead and figure out how it's going to look. So what you're going to do and when you're going to do it. I a lot of times suggest to my patients to buy a journal and track their activity. So what they did, how did they feel? I like that RPE scale. And then also what were their vitals? And then what were your overall symptoms as you were doing it? It's just nice to kind of track day to day. And then it going back to the progression that I mentioned. It's nice then because you can go back and say, okay, I've done this activity 3 days. It's pretty easy. I think it's time to increase it. Also, I was just finding something that you enjoy to do. My mom is a big jazzerciser, and so she's done that since the 80s. She loves to do it, and that's why she has the success of sticking with it, is because she loves to do it. When you find something that you enjoy to do and in this activity, it's not as much of a chore, and it's more something that you're enjoying doing, and you're more likely to stick with it then. Make sure you collaborate with your doctor to know if and when to use any kind of garment or sleeve, if you have any history of lymphedema, or also if you're at high risk for lymphedema. Some surgeons prefer that their patients wear the garment if they're exercising. Also, if you have a garment you wear normally, it's actually a great time to wear it when you're exercising because it actually helps with some of the fluid reduction. So that's something to know. And when you're talking to your doctor, maybe discuss if that's something of concern, you have a history of that. And then another thing would be consider using what we call a pulse ox. So you can get these at Walgreens, Walmart. They're just little, or Amazon. It's a little measuring device. And the nice thing is you stick it on your finger and it can tell you your heart rate and your oxygen level. These are really good indicators of how hard you're working. So depending what your diagnosis is, what your comorbidities are, it may be even more important for you to be monitoring these things. But the nice thing is, on the other side, I'll talk a little bit about what max heart rate and kind of target heart rate would be. But that's an indication of how hard is your body really working. So a max heart rate, and this is really just a very general, essentially measurement or suggested tool to use. So your max heart rate would be 220 minus your age. So that's your max. So if you're 60 years old, you would take the 220 minus 60, and you just would say 160 would be the max. When you're doing a lot of this moderate activity, you really shouldn't be hitting your max heart rate. However, what we find is with a lot of our cancer survivors, depending where they are in their stage of survivorship, their heart rate may be higher just with very low activity. And so that's just really showing us, like I mentioned before, how much stress your body is going through. So if you are trying to do like a high intensity activity, that 85 to 100% is what you're looking for. If you want for fat burning, which is not really what we're discussing in here, but that's always a benefit, right? Is 50 to 65% of max heart rate for fat burning. And then also for a good target level for a general healthy person would be 65 to 85%. However, for our population tonight, we really recommend starting in up to 50, 60%. And if you desired, you can work up to that high intensity. We talked about the different activities for that vigorous, RPE. But really, you should gradually work up to it, and it should take about 6 months. You really don't want to just dive right in and go right to the high intensity. So really, the point of this is keep in mind it should be personalized to you and what's appropriate for you. So with that being said, we've talked a lot about activity and exercise. So on the flip side, I think it's good to also talk about how can we conserve our energy. So with cancer-related fatigue, it can keep you from doing the things that you want to do. And it could be the simple activities like going into your kitchen and cooking, or like we even said, as profound as watching TV. So that being said, I think considering how to conserve your energy is an important topic as well. So the goal of energy conservation is to maintain your balance between rest and activity during times of high fatigue so that the valued activities can be maintained. So here's some strategies for just conservation of energy. So one would be to set your priorities and realistic expectations. So unfortunately, the reality is you may have to prioritize really what you want to do and also when you do it. And that's just letting your body recover. Your body is, essentially alarming you to the fact that it's using up more energy than it normally would. So I think being somewhat realistic about the situation and trying to essentially figure out what is really the goal, it helps. And so maybe you delegate the activities of lesser importance. So maybe if you want to do the cooking for dinner, maybe you have your significant other do the prep work for you. Or maybe you just eliminate the non-essential activities. So maybe if you are getting worn out with just doing your showering, maybe on that day, it's not essential for you to do the cooking that day. Maybe somebody else can do that. And then pace yourself. So I feel like I'm kind of a hypocrite. I'm not a very good pacing of myself, but it might be something where you have to do a little bit of the prep work. I like the idea of cooking. So maybe you do a little bit of prep work, and then maybe you come back and do some later and do it in stages. Or maybe you adapt how you're doing it. So maybe instead of standing at the counter, maybe you're sitting at the table for part of it. So essentially pacing yourself. You don't want to sit there and maybe do it all in one long stretch, and then you have essentially exhausted yourself, and now you've essentially kind of tapped into your energy reserves and you're essentially done for the whole day. So going along with that, taking extra rest breaks. When you are experiencing this fatigue, it's a time to really let yourself get the break. So it's finding a balance of activity, but also taking the recovery time as well. A lot of us have times of peak energy. Some of us are more, ready to go in the morning, middle of the day, or maybe we know we like our afternoon nap. So plan for the activities that require more energy when you know you have that peak energy. So you may have to adjust when you are taking your shower, or when you're going to the gym or doing your walk for the day. For some people, it'll be appropriate to use an assistive device. I think some people shy away from this because they're worried about dependency. Really, there's not a whole lot of link between the two. So if you need to, for example, maybe go to Kroger and use your four-wheeled walker, I call it the Cadillac with the brakes and the seat, and sit down and pace yourself and take breaks and use the four-wheeled walker, it helps you conserve energy. It might make it where you are able to do more and you're more comfortable while you're doing it. And then going along with all this, maybe ask for help. And I also included a slide at the end where it includes some resources for our survivors out there. So don't be afraid to ask for help. Some of our survivors out there are very strong and strong-willed people, and we don't like to ask for help, but maybe it's asking for help for the things that you don't like doing. So maybe you want to be doing your cooking, so you have to ask a spouse to help with the laundry, for example. So these are some of the community resources that I mentioned. So first would be the Christ Hospital Survivorship Group. I'm assuming most of you are familiar with it since you're here this evening. But they have social workers, financial resources, all different types of classes. So yoga, cooking classes, nutritional services. You could probably spend hours on the website alone just looking at all the different things that they have to offer on there. So that's a good starting point. Pink Ribbon Girls, it's actually kind of a neat group, and they were actually started locally, even though they're in a couple other cities. And really they help with a bunch of different things as well, but they help with specifically assisting with meals, maybe rides to treatments, house cleaning services, peer support. If you're not familiar with them, they are a wonderful resource. There's the Cancer Support Community. So they have a couple of locations around Northern Kentucky. I know there's one in Blue Ash. I've given a couple of talks there. They have also a variety of awesome things that they have. So educational tools and programs, social opportunities. They have classes. I was actually kind of jealous. I was looking at their calendar for this month, and they have knitting, aromatherapy, cooking, yoga, Zumba. The Blue Ash one last was there. They had a library. And they had computers that people could use. So again, it's just wonderful community. Tri-Health's Cancer Wellness Program. So this is a program that's free to survivors. From what I understand, it's at the Blue Ash Pavilion. It's one of the places where you could do this. And it's essentially a program where for 2 times a week for 6 weeks, you can essentially participate in a wellness program, doing aerobic activities, stretching, weights, and different things like that. So that is a good resource, kind of linked to the topic that we have talked about tonight. So here's my contact information. We have at Christ Hospital a bunch of different outpatient centers. So if you feel like you fall into the category of people who maybe you feel like you need the physical therapy evaluation, or in talking to your doctor, you think it's something where you want to get evaluated, see what really we have to offer. This is my contact information. You are more than welcome to reach out to me, and I'm happy to help with that process. Ohio is actually a direct access state. So what that means is you technically do not have to have a prescription from your doctor to access physical therapy services. But I would be happy to coordinate with that because I still recommend it, especially for this population. So we know who we're dealing with and some of the background information. But also I want to put this in here. So if you have any questions, concerns, anything, I'm happy to help with just about whatever. Christ Hospital, like I said, has a lot of resources in its community. So if I can't answer it, I will get you to someone who can get you the answer. So at this point, we'll see if there's any questions.
All right, Liz. Well, thank you so much. I do have one question that's been posted. I'll read it for you. So, Liz, it says, for those that are dealing with lymphedema, should we have a PT or trainer create a program for us? They've hesitated to really do any more than walking this past year because they're afraid that their arm is going to get worse.
Oh, yeah, that's a really great question. So number one, I would talk to the doctor, or if you had a physical therapist who has worked with you specifically for the lymphedema, I would talk to them. They're a great resource. Like I mentioned very briefly, since we were more talking about cancer fatigue, with lymphedema, most of my patients, so if I have a patient who has like an upper extremity sleeve, I would have them wear it while they exercise. The sleeve itself gives you the extra compression while you're working. And so that's an option. So and some, like I said, doctors actually want their patients wearing these somewhat preventatively. I personally would say I would not shy away from doing more than just walking. Walking it's one of those awesome activities. However, unless there's something else really, there's some people who really worry about certain types of activities. So maybe like your overhead lifting, like lifting with extreme weight. So like high resistance training, there's some schools of thought that could potentially trigger lymphedema. I have to say the research is really out. There's really not definitive research that says weight training will cause lymphedema, put you at higher risk. So I would encourage them to do a more balanced training program with you. And Heather, you are more than welcome to reach out to me with some more specifics for yourself. And I would be happy to kind of answer things more specifically for you. But really, I think so much of us are scared of lymphedema, and I commend your trainer because we don't want to make people worse, and that's physical therapists, trainers. That's our number one thing, is do no harm. But really, there's a lot of activities that would be appropriate for you if you are dealing with lymphedema. And then there's some things that you can do to modify as well. And if there's more you have kind of going along that, it's a very general answer for you. But I absolutely think there's a lot of other things you could be doing that are appropriate for you.
Awesome. All right. The next question I have is juggling fatigue with insomnia. Is there a good time of day to exercise? Well, that's a good question.
So that's a really good question. So I'm going to kind of take it two different directions, if that's okay. So the first would be activity itself. So activity, exercise, whatever you would really like to call it, is actually one of the best things for addressing insomnia. I normally joke, I say when I'm having issues with sleeping, I almost say I work out that little extra energy that I have, and then it really seems that when it's time for myself to go to sleep, my body's ready. I've kind of prepped. Typically, it depends what kind of activity you're doing. So if you're doing maybe like a gentle yoga, maybe Pilates, something that's a lower impact, that's something that you could do leading up to when you go to sleep. But typically I would do it earlier. when you have your burst of activity. So you don't really want to go do your activity, get your heart rate pumping and everything, your adrenaline going, and then try to go to sleep. So I would almost cater it to when you find that you have the most energy. So, and that can be hard if you're dealing with insomnia. It might be that you find you are just tired all day long. And the other thing I would say is there was a recording on the survivorship for, I think, sleep-related issues. So that might be something to watch as well, and see if you can get some tips and tricks from that presentation as well.
And I will place the link for our survivorship site, so you guys can take a look at that at your convenience. And like we said, this recording will be up in a couple weeks, but yes, you can definitely check out our previous series, and one of those is how to deal with insomnia. It's a lot of good suggestions there. Okay, another question. So do you know of any resources for adult swim lessons? I like to learn lap swim properly for exercise. And even though many Wise and Mercy Health Plexus advertise swim lessons, they've been hard to come by.
Interesting. That is a really good question, because the first thing that came to mind was actually, I know some of my patients have gone to the Blue Ash Y for adult swim lessons. Mm-hmm. I'm not sure if you would qualify, but we do have aquatic therapy at our Christ Hospital main campus. So I don't know. I'm not sure if that's exactly what you would be looking for, because they would work on exercise in the pool and some of the kind of like resistance and things like that, but it's not necessarily swimming per se. So outside of that, I have to be transparent. I am not entirely sure for lessons themselves, but if you were looking more for like resistance type activities, they'll use the kickboards, different water weights, the floats and things like that. It's pretty amazing the creative ways that you can really torture yourself in a pool. So that is something to consider if you'd be interested. And like I said, it may not be applicable depending on if you're more trying to figure out how to do the actual swimming.
And we can actually look into it. I think the Cincinnati Sports Club might have lessons, but I'm not sure if it's something where you have to be a member in order to get the lesson. So I can look into that and get back to you, Barb, for sure.
Awesome.
Perfect. Okay, I think that's it. Anyone else with any questions?
Okay, Alondra, I'm just going to go back to for the fatigue question with insomnia. One thing, and it's a little bit unrelated, but also just the time of day, also maybe around when you're eating. So I didn't really touch a whole lot of nutrition because to be honest, my knowledge of nutrition, for the really what is recommended for our survivors is limited. However, I do think that if you've ever noticed, a lot of times after you eat, like an hour or two later, all your food is essentially your blood is going to your stomach for digestion. So that's not really a good time to go out and start exercising. So you might want to time it with what your heavier meal is of the day. Or if you notice that you're more tired after eating like lunchtime, which is really common. We don't have siestas here, but there's something to be said about that overseas. So a lot of times our blood sugar levels are affected as the day goes on. So keeping in mind also how you're timing, or even eating a snack before you go exercise. So that might be something to play around with a little bit too, to help with some of the fatigue and the timing of the exercise.
That's great. Thank you.
I was going to add too, real quick, Liz. I think one of the things that I think Alondra and I see a lot and hear a lot is that this fatigue is like, it lingers forever. And it's something that is so frustrating, for a lot of patients, because, they're just trying to get to the point where they're starting to feel like their old self again. And it's a lot of times that main slap in the face, like no matter what I do, I can't get back to what I was. And I know we always say it's just, it's one step at a time, and you just have to really keep at it and working at it and knowing, who to go to, who to call, and where to start. And I think, I don't know if you have anything to add, but I know that's just it's such a, like, I don't know if it just seems like no one knows that this is something that's going to linger for so long after treatment.
I agree, Allison. I think that's a really great point because, I think it's really easy to make this presentation and say, this is what you need to do, and make it sound, in some sense, kind of simple. But the reality is it's not simple. It's not a short process. And it may be, really the goal for survivorship, like you at the beginning, would be it's a lifestyle change. It's for some of us. So it might be something that these people didn't do, beforehand. And so that's why I try to talk about some of the other benefits outside of the fatigue, because it's really can be meaningful, and it's not easy. And so I try to kind of present it in two ways of, you can do this with the guidance of a PT, but also here's just some general guidelines of ways you can do it, because not everybody's going to need PT, and it's going to be potentially a long haul. And some of those tips, like doing what you enjoy, because it's really hard when you are worn out to even imagine going and getting up and doing these things and starting. And so I think the hardest thing is getting started. I'll talk to my patients about within the hospital about the reason we have to start is I kind of envision the snowball. And if you are at the top of the hill and you're already fatigued and that ball goes down the hill, it just keeps growing and growing. So the unfortunate thing is, for some, it's not going to get better without being addressed. And for some, to be transparent, it might. But however, you don't have much to lose from, really investing in this. So I think you make a good point, because when you put it in paper and words, it just kind of seems simple, like just go do this. But the reality is, some days are going to be good and easy, and some days are harder. And that's also why I try to include the conservation, because and also not being hard on yourself. It's hard to do this for a person who doesn't have fatigue, let alone who has the fatigue in combination with this.
And I think that's really important to remember, just giving yourself that grace that you deserve when you've undergone so much with treatment, surgeries, whatever it was or it is. Your body still needs a lot of time to heal, right? And it's just kind of adjusting to this new normal, and maybe utilizing the time that you are feeling better, you're feeling well, to do the things that do matter, are important to you, like you said earlier. But sometimes, it sounds silly to say, well, in order to, fight off fatigue, you have to be more active. Well, it doesn't really work that way in a sense. But if you are, kind of utilizing that time to do the most when you feel the best, and just kind of adjusting to that new lifestyle, I think sometimes that makes a difference. And maybe we might not be able to reach that normal again, but this is going to be the new normal, and just kind of trying to do the best we can, when we're feeling better. Our next Survivorship Wellness series will be in January of 2022, and it is going to discuss nutrition. So we're super excited about that. That is going to come out hopefully by the end of the month. We'll send out a reminder for everyone, and you'll have to sign in or sign up through Eventbrite or through us again. All right, guys. Well, thank you so much for being here today. We really appreciate it. If you guys have any questions as regards to our survivorship program, if you'd love to meet with us, please reach out to Aaron, our nurse navigator. That's his number, 585-4154, or you can email him. But we will love to chat with you if you have questions, concerns. If you have not met with us after treatment, we will love to meet with you and just kind of, see where you are, what kind of resources and how we can help.